Phyllis Ringel, the executive director at the time, who had only been with the agency a year or so, called me and said she had a position she thought might be a good match for me, something that I would enjoy and was right up my alley and might be of service to the community. JFS had just agreed to work with 3 other community partners on a project called Benefits Checkup. And they had the concept. It was a pilot project started by the National Council on Aging and then United Way of the Greater Lehigh Valley. We were brought in with 3 other faith-based agencies, but we needed someone to tailor the project to the Jewish community. And so it was sort of working from the ground up, figuring out how it would work for our community specifically. Okay. So the National Council on Aging recognized that there were more and more people retiring in the first decade of this century. Baby boomers were aging, and all of a sudden they found that their Social Security was not really enough for them to live on. And so there was an increasing number of older adults who had likely worked all their lives, paid taxes, but now they were struggling financially. And National Council on Aging realized that there were government benefits that a lot of them were eligible for, but this was a population that was embarrassed to admit that they might need help. So they were used to paying taxes, not receiving, and they were very uncomfortable, and many of them didn't even know what they might be eligible for. So they were looking for a very low-cost way for people to be comfortable, but yet get help finding out what government benefits they were eligible for, and then have people assist those who could not go after the benefits on their own. So United Way of the Greater Lehigh Valley was one of, I think, maybe 3 or 4 agencies nationwide that developed a plan. And the plan here was to use faith-based agencies to organize teams of volunteers to keep it low cost. And the volunteers would actually go out and meet with people who might need some assistance. So the task that I had was to tailor the project, take it from United Way's idea to apply it to the Jewish community. We recruited, trained, and supervised teams of volunteers from Lehigh and Northampton County to get familiar with this web-based screening tool. We set up meeting spots at senior centers, at senior housing throughout the 2 counties, and we screened loads of people, and then those who were eligible, we helped get the forms that they might need to apply, and for those who couldn't gather materials on their own, we went a little further in helping them get the benefits. The other beautiful thing was that our agency had Barry Siegel doing case management, and so he sometimes referred clients to me. I often referred clients to him, people who needed help in other areas. Our food bank as well. We worked together, so it was a nice thing for the agency. The program morphed from a partnership with 3 other agencies to basically Jewish Family Service being the last man standing, kind of. We were the last one who ran it, and we incorporated some of the volunteers from the other agencies to do it. I did serve on the board of Jewish Family Service for a few years before I took this position. When I took this position, I felt it was very uncomfortable being on the board, and also, even though it was through a grant, being a staff member. And then I returned to the board a couple years after that, maybe in 2015 or 2016. Generally, we did not send volunteers into apartments. We for safety reasons, we met in the cafeteria, the community room, but there was a couple who requested help that lived in government subsidized housing in Bethlehem for seniors. They were profoundly blind, and that's why I agreed to come up to their apartment. I asked them the questions. They were very organized. And after going through this web-based screening tool with them, I quickly saw that they both would qualify for a program that was called MSP, the Medicare Savings Program. Now, this is many years out, so all of these figures may seem like very little, but at the time, this couple was living on Social Security. Together, they received about $17,000 a year, and that's what they lived on. Out of that little less than $17,000, they were paying $92 a month each for their Medicare B premium. And the truth is that at the time, they qualified for this benefit called Medicare Savings Program that would stop Medicare from taking the $92 out of their Social Security. So basically, as soon as we filed the paperwork, they had I think it was $184 a month more to live on. The woman gave me a hug afterwards. She said, I can afford to pay my husband's medical bills now, and I can buy fresh fruit each week. And it was like, it was very moving because their income went from roughly 17 to over 19,000. We serviced everybody. We did not just service the Jewish community, although we had percentage-wise more members of the Jewish community come to us than are represented in the broader community. But one of the things we did every year was set up a booth at Senior Fest at the Allentown Fairgrounds. One year, toward the end of my time there, I met a man who was a retiree from Bethlehem Steel. And I had never seen him before. He wanted to go through this. He explained to me that his retirement benefits were such that he normally would not qualify for any help, nor would he ever ask for help. But he was in a really rough situation because he had received an organ transplant a couple years earlier. And I think in March, he reached the donut hole, which means that for the first few months of the year, his Medicare B paid for his anti-rejection medication. And he scraped and borrowed money from family to pay one more month of the anti-rejection medication. This is the beauty of case management, which I'm a big proponent of. It's very easy to have programs that programs where you fill out forms and you expect people to do things, but sometimes they can be smart people, but they don't know how the system works. I started on the phone with some of the pharmaceutical assistance programs. This was really beyond the benefits checkup computer-based program. Eventually, I got through to the manufacturer in California that told me, based on this gentleman's income, he would be rejected. He could apply for patient assistance, but he would be rejected. However, they heard the story, they understood the situation, and they gave me a workaround, which I quickly called this gentleman back, told him what to do, gave him the paperwork, told him fill it out, send it overnight mail to this company in California. They would reject it, but they had to then, if he appealed, they had to give him an answer within 3 days of him initiating the appeal. And so 3 weeks later, he called me. Not only did he get the medication for that year, for the period that he would be in the donut hole, but he had a verbal agreement with them that every subsequent year, as long as he would use as much of a benefit as he could legitimately get from Medicare, when he hit the donut hole, they would cover the cost of the medicine for him.